Good morning, everyone. My name is Maya Luria with TMC for Seniors, and today we are going to be talking about Medicare and what's new with Medicare for 2026. I know there's a lot of important changes that are coming up that everyone is very interested in learning more about. I have Linda Khumalo here with me. She is with PCOA, or Pima Council on Aging. She is the Medicare Program Supervisor. How are you today, Linda?
I'm doing fine. Thank you very much. Thank you for having me on a
Great.
Friday
So
morning.
yeah, so you have a large online audience that is watching you today, along with a very large in-person audience. So we've got both today. If you're watching from home and you have a question, please feel free to put those questions into the chat, and I will ask Linda after she is done with her presentation. I know she's got a lot of information to share, so I'll go ahead and let her get started. I've gone ahead and put your PowerPoint up for you, Linda, so you can start.
All right. Thank you, Maya. Thank you, Jennifer, for having us. We partner with Maya and Jennifer throughout the year. And every Friday from 10 to 1, we come here whenever somebody needs a one-on-one counseling appointment. So it's been a great partnership for the past 3 years. And I am so surprised to see so many people. Last year when we did this, what's coming for 2025, there were about less than 10 people in the room. But you know why? Because it was on a Tuesday, election day. Yeah, yeah. So today the planes are grounded and there's another exciting thing happening. But I am Linda Khumalo. I am with Pima Council on Aging. I am the Medicare Program Supervisor there. I have two people that I work with. One bilingual staff is a Medicare specialist, and another person who's also in the office as a Medicare specialist. But the rest of our team is made out of volunteers just like you, people who are already on Medicare, who help us counsel and give you information that's up to date from the Center for Medicare and Medicaid Services. And they do this work for free at no cost to anybody. They live here in Pima County. They are your neighbors. They are supposed to give you unbiased information. We are not affiliated with any insurance companies. We get our information directly from the federal government. We are funded just a little bit by the federal government and hope they continue to fund us. And, and some of the donations from you guys who are so wonderful in Pima County supporting the work that we do. So the information you get from us, we are not going to tell you what plan you should be going with. We're going to tell you everything that's going on in Pima County as far as Medicaid information goes. And right there in the red font is our Medicare counseling number. If you need to get hold of us, that 520-546-2011. The PCOA helpline is the number that you call for any other concerns and information you need regarding seniors 60 and above. Could be anything. Just call that number and find out if they have any resources for you that they can help you with. So let's begin with this one. It's October 15th, and December 7th, Medicare enrollment is when it begins. What we know is that oftentimes people don't know what exactly they're supposed to be doing at this time of the year. This is the time for people who are already on Medicare, not somebody who's new to Medicare. They have a different enrollment period. This is the time when those people have already been on Medicare. They can enroll in a Medicare Advantage plan if you've been on traditional Medicare. And we'll talk about the difference between the two. And this is when you can change plans from one Medicare Advantage to another Medicare Advantage plan. I will tell you that in Pima County this year, we have at the most 77 plans to choose from. 55 of them are open to just about everybody. The rest, they require some kind of qualification before you can sign up for those plans. But if you're a Medicare Advantage person in Pima County, know that this year you've had a choice of 55 plans to choose from. Next year, it will be the same number as well. So this is what we want people to know, that you have an option rather than what you have been in for some time. And the next thing you can do here, there are people who are on traditional Medicare that can go ahead and change their standalone plan. Your prescription Part D plan, this is the time to change it if you feel you need to do so. And you can enroll in one or you can switch plans. What is not part of this open enrollment is not the time where somebody who has not enrolled in Part A, then this is when you sign up for it. Not necessarily. It's not that you cannot do that, but this is not the time where you have a deadline of doing that. It's not the time to newly enroll in Part B. It's not part of initial enrollment, Medicare open enrollment period. And then your Medicare supplement plan, this is not necessarily the time where you do that. You can do that any time of the year. They don't have open enrollment periods with Medigap or changing a Medigap plan. So let me go ahead and talk about this, because what we realize is that people sign up for Medicare not realizing what the difference is. There is traditional Medicare, and then there is Medicare Advantage that's called Part C. With traditional Medicare, and the reason we have those two lines in between is because the two don't join. You don't have to cross between the two. Let's talk about traditional Medicare. Traditional Medicare is that red, white, and blue card with just Part A and Part B, which I'm pretty sure most of you have. And with that card, it doesn't cover your prescription. So that's when you go for the Part D. You have to get a Part D card that will cover your prescription. That's what we call a standalone card. And now, because Medicare covers only 80% of all approved services, that's all they do. If something is medically necessary according to your doctor, they will pay 80% of that. And that leaves people with 20%. You are responsible for the 20%. What often happens, if you just sign up for Medicare and have that red, white, and blue card and get your prescription card, it's well and good for you to go to the doctor and the bill is $100 and you can pay the $20. But if it's $100,000, that becomes a little bit too much. So what often happens is you have to sign up. Don't have to. We recommend that you do sign up for a Medicare plan for supplemental coverage. On the other side of those two lines, you've got Medicare Advantage. That's different from the setup on this side. Medicare Advantage is just one card. Sometimes people call it Part C. So don't be the person that calls us and say, when do I sign up for Part C? I have A, B, and D. I'm missing C. You don't need C. You don't need C if you have A, B, and D. Part C rolls it all in one. It's Part A, Part B, Part D, and oftentimes in Pima County, for example, about 6 plans don't have Part D included. And people will say, well, why is it a Medicare Advantage plan without Part D? That's because oftentimes people get their medications at the VA. Here. So what does Part A cover? Part A is the part that covers your hospitalization. Anything you receive inpatient will come out of the Part A funding. Your rehab, your skilled nursing, but not long-term care. That's a totally different story. Medicare does not cover long-term care. And hospice coverage may come out of Part A. Part B is everything outside of the hospital, everything outpatient. When you go to your doctors, your regular checkups, preventative services, your diagnostic labs and radiology, MRIs, CT scans, and X-rays, all of that comes out of Part A. Your durable medical equipment, that's your walkers, your wheelchairs, your medical bed, your braces, neck braces, knee braces, all of that will come out of Part B. And some of the emergency and urgent care treatment will come out of the Part B section of Medicare. Now, this is the part that we always hope that we have this information by the time we do this 2026 updates. But unfortunately, at the moment, we still don't know. We still don't know what 2026 is going to look like for inpatient deductible. We do know that this year, it was $1,676 for inpatient deductible for Part A. And the daily coinsurance, you can see all of that. Those numbers, you have them in your slides. These are the skilled nursing facilities for 2025, in case you were not aware what exactly was the cost for all of this care. But 2026, we still don't have that. We're waiting for the federal government to tell us when they do. We will let you know. Premiums for Part B, again, we still don't know. We know what they're projected to be by people who crunch the numbers, but we usually don't give out that information until it comes directly from CMS so that we know that we're giving you correct information. But the premium for Part B this year was $185. Your deductible when you go to the doctor, outpatient services, was $257. So we know it's going to change and go up next year. It usually does. And we know the premiums are going to go up because they usually do. Now, here's the part that has a lot of people kind of a little bit concerned and nervous. It's the WISER model. It's called the Wasteful and Inappropriate Service Reduction Model. And this will take place effective January 1st. It's a pilot program they're going to run for 6 years for 6 states. And Arizona happens to be one of those states that they're going to test it on. It's people who are on original Medicare, which not typically, original Medicare does not require prior authorization. You go to the doctor wherever you want to go, whether you are in Arizona or whether you are going to Boston, you can see a doctor. And when the doctor says something needs to be done, Medicare typically says, okay, we'll pay our 80%. Your Medicare picks up the 20%. But there are these 17 services that next year they are saying, we need to know if these are really necessary. Are they any help, or maybe it's just a waste of money for us to keep paying for this? So there's the list of 17 original Medicare prior authorization services. You can go down the list and see the nerve stimulators. A lot of people get some of the services, but don't be surprised next year if they start saying, well, we need to get prior authorization first. Prior authorization is usually something that people see with Medicare Advantage, with HMO and PPO. But now this is concerning a lot of people because original Medicare didn't used to worry about, is this necessary or not? But these things, the 17 services, they kind of want to look into them and see what comes out of it. So after 6 years, we will see what they decide to do. They may decide this is not saving us any money, or doing away with it, or they may decide that they will keep it. So go down that list and see if there's anything of concern, but that's where we are at this point. Now let's talk about Part D. That's your prescription coverage. Part D is in Arizona, we have this year 12 different standalone plans that you can choose from if you're somebody on traditional Medicare. And some people who are on Medicare Advantage may have to get a different Part D plan. Now, if you are, let me see, for 2026, we are going to have down to 10 different plans for Part D. It used to be last year we had 21, the year before we had 28, and it's going down and down, and they're consolidating, and some are leaving the county, and we'll talk about that in the next slides. So those premiums, we do know what they are. Okay. You have to be enrolled in either Part A or Part B to be able to enroll in a Part D plan. And original Medicare, as I mentioned a little bit ago, is that with original Medicare, you have to buy a standalone Part D plan because the red, white, and blue card by itself does not cover your medication. Medicare Advantage, as I said, it's often included with the plan, and each plan has a formulary. This is very important in that not all plans that you sign up for may cover all your medications. This is why we always emphasize around this time of the year during open enrollment is that review your plans. Make sure that your medications are still covered by your plan for 2026, or make sure that the plan that you're paying for right now, if it does go up, is there another plan that is cheaper than what you have that's coming up in 2026? But you want to make sure that your medication are in that plan's formulary. Those will vary from plan to plan. And if you sign up for, if you stay with the plan that does, if you stay with a plan that doesn't cover your medication, you end up paying full price. If you stay with a plan that doesn't cover your, say, for example, your insulin that we know is kept at $35 copay, you may wind up paying 3-4 times that because your plan doesn't cover it. So be mindful. If you don't do anything, if you're somebody who's taking medications, please do your plan comparison, this open enrollment, so that you can switch while you have the time. You won't be able to switch after December 15th. These are the premiums for Part D. I mentioned that we are coming down to 10 plans for next year. This is just in Arizona. And then the premiums will be ranging from $0 to $119. Out of the 12 plans we have this year, 2 of them are 0 premium per month. And then 1 of them is 80-something cents. Next year, we are going to have 4 of them that are 0 premium a month. Those are well and good, and they help a lot of people if you're taking your tier 1 drugs, but you want to make sure that they will cover all your prescriptions, because they may not be good. They may not be the right plan for everybody. And then there's the national-based premium. That information concerns people who have a penalty, who didn't sign up for Part D when they turned 65 or signed up for Medicare, but decided, I'm not taking any medications, which will warn you against not doing. And they say, I'm not taking any medications, so why am I taking a Part D plan? And then come 10 years later, now they have a penalty, which is 1% of the national-based premium for every month from the time you signed up for Medicare and did not sign up. And it will stay with you for the rest of the time you are on Part D. The low-income subsidy benchmark is for people who are on limited income. That's the limit of the coverage they get from their Part D plan. The other thing that came up last year, or rather this year, my mind is looking forward. This year, the cap for maximum out-of-pocket. That's the total amount you pay out of pocket for your drugs, including your premium, your copays, and your coinsurance. Does not include not your premium, your deductible does not include the premium. Deductible, copays, and coinsurance, once you've paid up to $2,100 in 2026, then the plan pays the rest of it at 100%. This year it was at $2,000, so it's gone up a little. But keep in mind, this is the conversation around the donut hole. Before the $2,000 that it is this year, it was $8,000. You had to pay up to $8,000 before your plan will then kick in 100%. Prior to that, there was nothing. There was no cap. Keep in mind that the prescription drugs came in on the coverage rather came in the market just in 2006. It's very recent, so they're still working with that. And with the Inflation Reduction Act, it came down that donut hole was done away with, and then we have the maximum at $2,000 this year, and it's going up a little bit at $2,100 next year. There are, as well as I do, that there are people who hit that amount within the first 3 months of the year. And it does include your copays, of course, in your deductible, but if you are signing up for a plan and you have drugs that are not in that plan's formulary, that doesn't count towards that. Like I say, if you are taking drugs that are not in your formulary, then you have a problem because that doesn't cancel out of your maximum out of pocket. And it doesn't include the penalty. And the other thing that came on this year and continues next year is the prescription payment plan. I'm very excited about this. For somebody then who's maximum out-of-pocket is going to be $2,100. You can call the insurance company directly that covers your drugs and tell them that you want to be on a payment plan. So they will break it down to 12 payments a month, and you make your payment directly. And that's great, because typically the payment will have been loaded up front in January. It's Christmas or it's the holidays and whatever, and the next thing, here you are with your $500 copay for your drugs. And they said, nope, we can break that down to 12 equal payments. And if you do sometime during the year are prescribed another drug that comes on, or one comes off of your list, they make adjustments accordingly as well. So this is a very convenient way of doing this. For people who signed up for that this year, it will automatically roll over that you have signed up for a prescription payment plan. But if you no longer want to do that, you have the option to opt out of it. We talked about the cap, and let's talk about which plans are here in Pima County in Arizona. We know that Cigna is leaving. I'm not going to go through each and every plan. You can see that, you can read it on your slides, and we can email the slides to you. But we try to make it as clear as possible that Cigna and WellCare are no longer going to be available. If you are on those two standalone drug plans, it's time for you to find another one. And they probably have sent you a letter by now saying we won't be here in Arizona. So find another plan. There are no new plans coming in the market because, of course, we are down from 12 to 10. And then if you're somebody with limited income, here are the plans that are available for you. Cigna, by the way, and as you all pretty much know by now, has changed the name from Cigna to HealthSpring Assurance. So they've sold their business to HealthSpring. So when you hear HealthSpring, HealthSpring is what Cigna used to be. There's also the thing where they change the names for whatever reason. They decide, well, I did say Cigna changes the name. I was thinking about renaming. But what you always want to make sure is you look at what will tell you is the plan number. This is what tells you more than anything what kind of coverage you have, that plan ID number. So the name may change, but if the plan ID stays the same, that means it's still the same plan. Now we're going to move on to talking about Medicare Advantage. I did say Medicare Advantage includes all three, Part A, Part B, and Part D, it all rolled in one. It's one card that you present when you go see your doctors. In order to sign up for Medicare Advantage, you have to already be enrolled in Part A and Part B so that they can then include Part D for you as well. It is run by private companies. These are the ones that you see advertised the most in your media and the news, on the internet, and everywhere else. Here's the part that also trips people the most, that we always have to talk about. The difference between these three types of Medicare Advantage. You have your HMO, you have the HMO POS that just came on the market about 2 or 3 years ago here in Pima County, and then you have the PPO. The HMO, the biggest thing about it is that you need to have your primary care physician. Everything you're going to do has to go through your primary care physician. Some people consider that gatekeeping, like, oh, I have to go talk to my physician first before I go talk to a dermatologist when I know that it's a dermatologist that I need. Some people don't mind. They want to tell their physician, like, what do I need to do with what's going on with me? So you're going to need that referral oftentimes. And you have to use the network provider. They keep you to the network that they're contracted with. The emergencies, they are covered out of network. If you're visiting somewhere in, let's say you were in Flagstaff and something happens there and you hiking and you break your ankles, God forbid, and then they will fix that as an emergency, but they need you to come home to get follow-up care. The other thing we always advise people to do is to check and see what exactly constitutes an emergency. A broken ankle is obviously, it needs to be reset. But there are some things where you said, I couldn't breathe and something happened and I went to the ER. We've seen issues where people say, well, that's it, there was not an emergency. Then you have to pay for it. So find out exactly what constitutes an emergency other than the obvious. The HMO POS is a hybrid of the PPO and the HMO. So let me talk about the PPO first. PPO is the one that has some kind of freedom a little bit. You can choose, you can go see any specialist you want, well, specialist within their network without having to go through your PCP first. If you know you need a dermatologist to look at something, you find a dermatologist within their network and go get taken care of. You have to go to their participating providers, of course. And sometimes it allows you to get coverage outside of the network, but it's going to be at a little bit of a higher price. You've seen some of the larger name plans will have a passport program where if you decide to go spend some time, let's say in Seattle or wherever, they can cover you there if you go see the doctors that they are contracted with in that part of the country. And then in between, we have the HMO POS, which is a hybrid of the two. This is the one that functions on may go see somebody outside, but check with us first. You may go find a specialist on your own, but check with us first. So be aware of what you are signing up for. And if you're somebody who's fine with just working with the doctors here in Tucson, in my network, which is going to be Tucson, because when you go to Maricopa, it's going to be a different kind of plans as well. Your HMO might work just fine for you. If you're somebody who travels a lot, who's on the RV and who has 2 homes, or you live in Flagstaff half the time, you run away and leave us with the heat in Tucson, and with you're out there now, it's cold in Flagstaff and nice and cool for you, that's fine. But you may want to consider traditional Medicare, because traditional Medicare doesn't have a network. It covers you coast to coast within the United States. So the HMOs, just the HMOs, the ones that need a referral and a PCP, these are the plans we have coming in and leaving Tucson next year. I'm not going to go through all of them, but is anybody on a Banner Medicare Advantage plan? Because that's very important in case somebody online does. The Banner Medicare Advantage plan is leaving Pima County. And if you are the person who is on Banner, and you need to know that there are some things that you need to be aware of. I thought I had it back there. In any case, we'll talk about Banner living Tucson, what that means for you. These are the HMOs. I'm not going to go through that in the interest of time. You have those on your slide. PPOs, living. Let's see. Okay. I thought I had the slide about what to do if your Medicare Advantage plan leaves the county or leaves your network. That can be a huge advantage for a lot of people, because if you're somebody who was considering moving back to traditional Medicare, this is the time you have that guaranteed right period of 63 days where you can just switch over, get a Medicare plan without having to go through medical underwriting. So if you know somebody whose Medicare Advantage plan is leaving the county, primarily Banner that we know of, then let them know that they need to look at the material that was sent to them, because they may be able to move to traditional Medicare without any medical underwriting with the Medigap. Moving on to the special needs plan. I did say earlier that we have 55 Medicare Advantage plans, but total is 77. The other 55 are open to everybody, but the other remaining 22 or so, those are for people who have special needs, kind of like chronic issues, kidney issues, cardiovascular diseases. Those plans are specifically tailored for those people. You don't have to sign for it, but they tend to have some benefits and extra services that may be useful to somebody who has those conditions. Diabetes, for example. If you're somebody who's in an assisted living facility and you don't want to keep going to doctors and finding transportation to get you to the doctor's offices, those plans may also provide a nurse who comes, or medical professional or doctor for that matter, who comes to the assisted living facility that you live in. But for those special needs plan, you have to have an official diagnosis of that condition before you can sign up for it. Otherwise, for everybody else, you still have those 55 plans. And I'm not going to go through all of them. You can see which ones are living and which ones are new. Just take your time when you get a chance to go over those. And which ones are renamed. If your plan seems to be renamed, always look at the plan ID number. When you look at your Medicare card, always look at the plan ID number. That's what tells you exactly what kind of coverage insurance you have. These creative names are well and good, and they can be confusing if you go by them, but the plan ID narrows it down exactly to what kind of plan you've got. And then we have this wonderful give back reduction that also just came in the last two or 3 years here in Pima County. This is where when plans want to entice you to sign up with them, they give you, it sounds like a rebate. Rather than this year maybe taking out the whole $185 out of your Social Security check to pay for Part B, they give you a discount of maybe we'll only take $100. We'll give you $80 back. So your Social Security check has $80 extra every month, rather than the $185 that they take out. There are many plans of the 55 that I talk about that have this give back or reduction, or what we would call a rebate. They range from they will give you back $1 all the way to $184.70. $1. So there's been some crunching of numbers. Nothing is arbitrary over here. So these are the plans that give you money back. I will ask you to read those at your leisure, and how much they give you back. And then this is the part where we talk about how you make those decisions, because we do know that a lot of people, they just sign up with a plan because the friend, a neighbor, or somebody says it works for me, but it may not work for you the same way. So when you're looking at choosing either original Medicare or should I take Medicare Advantage, one of the things that you look at is referrals. Do you want to see a provider without having to get a referral first? Some people don't like that. Some people don't mind. Let me go to my doctor, and the doctor will write down the referral and send me to the specialist. Your provider choices. Do you have doctors that you've been working with for some time that you don't want to change? Because you may switch it to another plan and find that your doctor that you've been working with is not contracted with the new plan that you've decided on. Do you want to have access to doctors who do not take assignments? Doctors who do not take assignments are the doctors who say, well, this is how much Medicare reimburses doctors for the service that they provide. But they want to have the ability to charge $15% extra over what they are providing here, over what Medicare reimburses. My mind is thinking, the Mayo Clinic in Scottsdale, so far we know that they do not take Medicare Advantage. So if you're somebody who knows that I want to be able to go to the Mayo Clinic if something comes up, you may have an issue, in Scottsdale that is. You may have an issue with having them take your Medicare Advantage. If you're somebody who says, I have a friend who said, go to Boston and that's where the best doctors are, you may have an issue if you have Medicare Advantage, because that may be out of your network, that may be too expensive. But traditional Medicare, they say, well, if the doctor's taking you patients, that's fine. Go in, we'll pay our 80%, and your Medicare will pick up the 20%. It's a matter of how free do you want to be with your coverage. And your health concerns, really. Now, I've been in this work for some time to know enough that at 65, people are doing wonderfully great. And all they take is multivitamins. And this is the reason why Medicare tends to be so individualized, because it looks at the probability of you having what's what runs in your family. What are the chances of you experiencing the same thing, having the same issues that the people in your family have? What are the chances of you going to need more care? These are the things you need to think about. Where people say heart disease runs in my family, and I know what I want to do when that should that happen to me. I know I want to make sure that I have the kind of coverage that I can be comfortable with. You have to look at that first, because there are plans that you can sign up. Let's say Medicare Advantage plans, for example. If you're young and you don't have any issues, it's fine. You're doing great. But are you okay if something comes up and there's that cancer comes up somewhere along the line 5 years later, and having to go through prior authorization? You decide. And referrals and all of that. Some people don't like that, but some people feel like they have no choice. They have to go with it. And then there are additional benefits with Medicare Advantage, which are great, because Medicare doesn't cover dental, it doesn't cover hearing, it doesn't cover vision. So Medicare Advantage will cover those three, but those are extra benefits. They are not mandated to cover those. So they give really competitive coverage on that in order to entice you in. They can take them anytime. Every year. They may cover your dental for up to $3,000 maybe this year. And also we say, do find out what exactly they mean by having your dental coverage, because they might just do the basic x-ray cleaning, but once you need root canal and crowns, that's out of your pocket at that point. So be aware of what it means to say they cover dental. We always advise that that should not be the reason why you choose a plan with Medicare. You want to check with your health first before, I mean, I'm not saying vision and hearing and other health, but you want to make sure that your regular general things are covered first, and then consider if it's necessary to choose a plan based on those things, on the dental and free gym and vision and hearing. This pretty much sums up the same thing I just said, the network. Do you mind getting all your treatment within the network in Pima County in Tucson? Or do you want to be able to go to Boston, to Colorado and see the best specialist? This is how you decide. Prescription are your medications. If you're somebody who takes medications every month, you have a list of medications you take, you want to make sure before you sign up for that Medicare Advantage plan that they will cover those medications. Travel is not necessarily, we're not talking about you're gone for 2 weeks and come back and you just visiting. We're talking about if you want to go, you're in an RV and traveling and you wind up somewhere else. Will your Medicare Advantage cover you there? The ones with the passport program, do they cover services for you if you find yourself, let's say, in Idaho? Somebody yesterday mentioned about traveling to Washington and they had the program that allows them to see a doctor in Washington state, but she was in Seattle and the doctor that they were contracted with is in Spokane. So those kind of things, just because it says it will cover you when you're in Washington, how far away would it be for you where you are? I mean, they may cover you here, but the doctor you need to see is in Flagstaff. Be mindful of those things as well. And then the costs, of course. Some plans have a premium above the 185 for Part B premium that everybody else is paying. How much is it, and what exactly is it giving you back? And then there's a star rating, which is very, very important. It's so important that plans go to court over this if they're rated. Star rating goes up to 5 stars, and we don't have a 5-star plan here in Pima County. We have up to 4.5 of the Medicare Advantage star rating. Some people really do want to go with a plan that has a good star rating. But again, of all these things, we say pay attention before you switch to the plan. Just because it's a higher rating, make sure that it covers all your needs. When to enroll? I'm pretty sure everybody in this room knows that it's open enrollment, because you are getting mail, you are getting phone calls, you are getting advertising. This is the time. You have up until December 7th to make a decision. If you are on Medicare Advantage, you get to do it again. They give you another chance in January 1st up to March 31st. You have a chance to review your plan. If in February you say, well, I chose a plan in December and I went to see the doctor, I didn't like it, I'm going to change it in January if I'm on Medicare Advantage, and then it will take effect February. You will have a new plan. Only if you're in Medicare Advantage. Everybody else, if you change the plan right now for Part D, then everything takes effect for January 1st. In the interest of time, everybody knows what to do over here. You can call 1-800-MEDICARE to enroll. You can go to Medicare.gov. It's a wonderful, wonderful website that we rely on heavily, with Medicare.gov. Just go to that website and look around and see what you can do. I'll talk about it in a bit. And to enroll in Medicare Advantage, I did mention that you have to have both A and B, because it requires A, B, and D. And so you have to have both A and B in order to get into a Medicare Advantage plan. To get a Part D plan, you simply need either A or B. That's up to you. This is what I talked about, I was referring to earlier. If your Medicare Advantage plan is discontinued, which is what is happening with the Banner plan that we talked about, these are the things that somebody will have to review when they find out that doctors or the providers that are no longer taking that plan, or the plan is leaving the network. But the wonderful thing for the people, if you're somebody who's been on that Medicare Advantage plan, is if you wanted to go back to Medigap, then you have a 63-day guaranteed issue that you can choose a Medicare plan and go back to traditional without going through medical underwriting. It's been very helped. It happened again last year. There's a plan that left the network, that left Pima County, and people were able to sign up for a Medicare plan. Because oftentimes people, sometimes as time goes on and the needs become more, your health needs become more, people start asking about moving back to traditional Medicare. And what do I need to do to get a Medigap? Once you've lost that guaranteed issue in the first 6 months of signing up with Medicare, then there's medical underwriting. If you have health concerns, then out of the 38 plans that we have here in Arizona to choose from, they may put you under underwriting before they decide whether they will take you, or no, we cannot afford to take you, or we can take you at a higher premium. There's a special enrollment period that started effective January 1, 2026. And this is because of the Medicare Advantage, rather because of the Medicare.gov website. They are putting together a page where you can select a doctor and see if your doctor is in your network. Typically, we say, before you sign up for a plan, call your provider that you work with and ask them if they work with this plan, are they contracted with this plan. But Medicare.gov website is trying to make sure that they have the up-to-date, correct information about which doctor is contracted with whom, so you don't have to do all that work. So if you go through that page and you enroll because of the information they told you that the doctor is in the network, only to find that the doctor is not contracted with that plan, you have a special enrollment period to go ahead and then sign in for a plan that actually is contracted with that doctor, or the doctor is contracted with. If this happens to you, let us know. If in January you go see a doctor and they say, no, we're not contracted with this plan, only if you have signed up, enrolled for this plan through the website, because they're trying to create a database here that works for everybody and is accurate. And this is the Medicare.gov website. Now, the picture changes all the time, but it's www.medicare.gov. And there's the section where you can sign up for, you can go and check and look for new plans, rather, and compare plans. You can create an account. On the second section, you don't have to create an account. You can go in and just look at different plans that are very available. They have 2025 and 2026 already. Or you can create an account that will keep your information. So every time you go in, it keeps up with everything that involves Medicare for you. Prescriptions. When you're looking at that website, make sure that you know which ones are preferred pharmacies, which one are network pharmacies and out-of-network pharmacies. The price changes accordingly. Preferred pharmacies are the ones that tend to be cheaper, but network pharmacies may be a little bit more pricier than the preferred. Out-of-network is just expensive. So know the difference between those three. If sometime during the year your doctor puts you on new medication and it's not part of your plan that you have chosen during this period, or rather, let's talk about the tier. Rather, if your plan, if the medication you're taking is going to be in a different tier and is more expensive for you, you may ask for a tiering exception. There are 4 or 5 tiers depending on each company. The highest tier is the most expensive drugs. The tier 1 are the regular run-of-the-mill generic, and those are cheaper drugs. But if they put you on a medication during the year that is a little bit more expensive than what your plan can cover, you can ask for tiering exception. The same goes with the formulary. You're selecting a plan this period because you say, these are my medications, and they fit in the plan's formulary. I'm enrolling, only to find in July the doctor puts you on something else that's outside of the formulary. You can ask for a formulary exception until you choose a plan for 2027 that covers everything. There's help with Medicare costs, Medicare Savings Program for people who are on limited income. You can talk to us about that to get detailed information. And then I would be remiss if I didn't tell you to be careful about aggressive marketing. If you are not sure what you are seeing on TV and it seems so good and too good to be true, please don't hesitate to call us first before you sign up. Do not call the numbers you see on TV are really not your friend. They know what they're doing. It's aggressive marketing. I say this because throughout the year, we deal with the senior Medicare patrol issues. Somebody who calls us and say, I've inadvertently given my Medicare number to somebody, I don't know who it is, because the person called them and they answered the phone and they were chatting with them and they got their information. It happens. And it seems to be happening a little bit more during this time. I was thinking about this, but is it because it happens when there's a change there's confusion in the air about what the policies are, and that's when the scammers come out. We're getting a lot more calls of people saying, somebody said they were going to give me a new card. Medicare is not giving new cards. It really it isn't. And if they were, I don't think they have enough manpower to call every Medicare person and say, here's a new card for you. It used to be, I understand, some time ago, your Social Security was in your Medicare, it was your Medicare card. And they had to change that. And the scammers have capitalized on that information since then. But for some reason, it started up again. People saying they're going to get new cards and then give out their numbers. You just won't believe what we have to help with when people call us. There are marketing rules for brokers and agents. Brokers and agents are wonderful people. Their good work goes towards the rating of the plans as well. So it's in their best interest to be reliable and trustworthy people, but you will get the unscrupulous set that will try and get one over. So be careful, know exactly what they can and cannot do. A broker is somebody who may represent more than 2 or maybe 4 companies, plans under that company. An agent works with one particular company. When you talk to them knowing that there's a number of plans that they may not be representing. So know what your options are before you decide to sit down with this one person. These are the mailing. I'm pretty sure some of you are getting some of these envelopes. It looks like it's Medicare Savings Program, and then it must be good. Believe it or not, people fall for this. This is why we have it on the slide. But if you read the fine print, as we say, always read the fine print. It might seem like it came from the government, but it will tell you in the fine print, this is not an official notice from Medicare or any other government agency. Honestly, anything that comes to you unsolicited is something you really have to think twice about before you participate. Always read your Medicare summary notice or your explanation of benefits. Those are the statements you get every month or so, every 3 months, telling you all the services that you've received. This is how we found out about the COVID scam that was also prevalent here in Pima County. We kept getting people calling and saying, I have this COVID kits that was sent to me. I'm billed for COVID kits I didn't request. That's how we knew that during COVID, people are getting billed for COVID tests that they never ordered and sometimes never received, or sometimes they received and didn't even order. So that means those people, whoever the scammers are, they have their information. They have your Medicare number. You don't want your Medicare number all over with people who don't need to have it. So guard it. Read your Medicare summary notices and your explanation of benefits, and make sure that all those questions, when you answer them, everything seems clean. And we also added the helpful resources. These are the websites we know we can vouch for. You can trust and visit and see if you got any information in that. And you can always call us too. We'll do the work for you as well. And this is my last slide. I think I get that within time. Yeah. We are Medicare SHIP State Health Insurance Assistance Program with Pima Council on Aging. As I mentioned earlier, there are 3 of us in the office. So when you call us and you leave a message, we will call you back within 24 hours. Leave us a message and tell us what it is that you're calling about and what is the best time to call you so that we don't play phone tag. But we do make sure to call people within 24 hours. And if you prefer to email us, you can email us as well. We respond in a very timely manner. We have 16, 17 wonderful volunteers who do this work for us. They are trained and certified. They are on Medicare just like you guys. So you will be talking to somebody who understands exactly what your concerns are, but who's also been trained to be able to counsel and give you direction. We don't sell anything. We don't sell your information. We just want you to be informed and make good decisions. Even if you talk to us and then you say, okay, now I'm going to go talk to my agent. We really want to use us for your research and then decide what you want to do. And that is my last slide. And thank you.
Thank you, Linda. So that was amazing. So before I pull your presentation down, I did have somebody who asked if you could put up the Wiser slide again with the procedures that the 17 procedures that are going to be part of that.
Okay.
They wanted to take a look at that list again. Can you share a little bit about the AI component of the Wiser program so that people understand what that means?
Yeah, there are some companies, AI companies that will be doing this work, and in deciding what is a go for prior authorization, they will use AI companies to say either yes or no, this can be done. And this is making a lot of people uncomfortable, understandably so. You want human eyes to see it. And the fact that the thing that makes people a little bit uncomfortable is the fact that whichever company saves the most money for the program gets much better compensation or something to that effect. And so when we always are concerned whenever there's a financial incentive to doing something, it then becomes fertile for being misused. But that's what they say they will be using. The government or these companies will be using AI to decide whether the authorization requests that have been sent for these 17 items will be decided by AI, whether they will be approved or denied. But they also say we will make sure that we also use human eyes to make sure that the AI made the right decision. So double check AI. And that's all we know right now about it.
Okay. I'm assuming there must be some sort of way to put in an appeal if something is denied, I would guess.
I will expect so, because as with every claim, whether it's traditional Medicare or Medicare Advantage, they will tell when they deny something, they will tell you why they denied it, and they say how you can appeal it. Now, how easy that's going to be, there usually is a time constraint on when you can get these things done, but there's always the option to appeal denied claims and authorizations.
Okay, great. Now I have quite a few questions that have come in, so let me just sort of go through some of these, and hopefully that'll help us to answer any questions that people in person also had. Can you be denied coverage if you switch plans with UHC?
No, if you switch plan from UHC to another Medicare Advantage, UHC is a Medicare Advantage,
right,
to another one. No. There's no underwriting from Medicare Advantage to another Medicare Advantage. That's illegal.
Okay.
The underwriting only happens with Medigap. And then I'm wondering if the person is asking because UHC also sells some Medigap plans, the supplement plans. If that's what they are asking about, if it's a Medigap plan, there's most likely going to be an underwriting if it's outside of your guaranteed issue. But for Medicare Advantage, the Part C to another Medicare Advantage, which UHC also offers, there's no underwriting. They cannot deny you for that.
Okay. Can you switch from Part B from one version plan N to another that's a K?
Yes, you absolutely can, and that's a Medigap. Medigap switching outside of your guaranteed issue time period, there's going to be underwriting, and if they take you, they take you. They can take you, or they may not take you. It's up to them.
Okay. We had a couple of folks that were tuning in from Cochise County asking whether the plans that you discussed are those also the same in Cochise?
No,
no, right?
I'm trying to think in my head who my partner is in Cochise. we do have a number that, they're not. But if you
Okay.
go to Medicare.gov, it asks you for your zip code, and it only shows you plans in your area.
Okay. Thank you. Thank you for that. I know you discussed HMO versus PPO. I think you gave a good explanation as to how people can maybe, choose what's right for them. They're asking what was best, but of course it's really what works for each person, right? Okay. For a veteran, do you need to sign up with Part D if you get your prescriptions from the VA? And I know you slightly touched on that at the beginning.
Not necessarily. That's considered creditable coverage for a veteran, which is why out of the 55 Medicare Advantage plans, we have about we have 6 this year and 8 next year that do not cover Part D. They are for people who get their medications at the VA. So you don't necessarily have to get a Part D plan. Yeah.
Okay. Can an ambulance take you to the hospital that your doctor is affiliated with if it's a half mile further than the nearest hospital?
For an emergency, the rule is take it to the nearest hospital.
Okay.
For an emergency, take
Okay.
it to the nearest hospital.
But they can ask, obviously, depending on what if it's an emergency, right? I'm guessing. I don't know. I mean, like they can ask, but there's no guarantee, obviously.
As with everything with Medicare, there's always a caveat.
Yeah. Okay. If you are on a business, if you're still working, you have an employer and you're over 65, do you have to lose that coverage before signing up for Parts B and D?
If you're still working and you want to continue working past the age of 65 and you have your employer's coverage and your employer has 20 or more employees, you do not have to sign up for Part B. And you also, if you have an HSA, this goes in the weeds. If you have an HSA, you shouldn't be signing up for Part A. But if you have your employer coverage, you do not have to sign up for Part B because they're billing you. They will bill you that 185 that we have this year, and you also are paying for insurance, and yet the two don't work together. There's no coordination of benefit. It doesn't help. It doesn't give you better coverage to have both Medicare and your employer's coverage.
What about Part D?
But if your employer provides prescriptions, you don't have to sign up for it.
Okay. So you don't have to sign up for Part B and D. You're not required to.
You're not required to if your employer has 20 or more employees.
Okay.
If they have less, you have to.
Okay. Somebody asked about, you mentioned the Mayo Clinic not accepting Medicare Advantage. So if you went there, you are just going to pay out of pocket for services. Is that correct?
Just the one in Scottsdale that we know for sure. Now, there are different Mayo Clinics. There's one in Florida, one in Minnesota. But the one in Scottsdale specifically does not take Medicare Advantage.
Okay.
Even if you want to pay out of pocket, they will not.
Okay. What if you're traveling out of the country? How does your Medicare work then?
Medicare, by its very nature, works within the borders of the United States. When you go across to Mexico, it doesn't cover you there. Medicare Advantage would say they have in their extra benefits, which they're not required to give you, but they will say they will cover you when you're traveling. So find out from each plan that has that benefit. What exactly do they mean they will cover you outside the country? One of the things I know we've heard is somebody was overseas and used their Medicare, or rather they pay for the services when they needed health service, and then they came back to the United States to be reimbursed. So it may be working on reimbursement basis, but it's not all plans. Okay. If you're on traditional Medicare, you just won't be covered outside the United States. You won't be covered in Mexico. We always advise Medicare or Medicare Advantage, get travel insurance that you understand.
Perfect. Yeah. Does the current government shutdown, does that affect anything with the 2026 plans? That we know of.
No, on the fact that we already have this premiums for Part C or Medicare Advantage. We just went over those. We have all that information. Wonderful. This is the one time I'm loving these private companies because they're on top of it. We got this information by the end of, I think it was just before October 15th. Now, the premiums with traditional Medicare that everybody has to pay their Part B, I really couldn't say for sure that it has anything to do with the government shutdown. Every year they seem to be later and later and later. And I was looking at my calendar, what happened last year. I think we got it around November 19th. I think it was around November. I think we did this presentation November 4th, and we didn't have deductibles and Part B premiums.
Right.
So I'm kind of sort of waiting to see what happens. If we make it to December without the premiums, then that's what it is.
Okay. With open enrollment happening and those who are enrolled in traditional Medicare being switched on January 1st, what do we do now?
Traditional Medicare is not switching anything. If you're on traditional Medicare, you have that red, white, and blue card. And
what is Medigap?
Medigap is a supplement plan that's run by private companies. We have 38 different companies, I think, here in Arizona. Now, as I mentioned that traditional Medicare only pays 80% of your covered services. They are wonderful in that when the doctor says, well, we need to do this, Medicare says, okay, good, we'll pay our 80%, but Linda's going to be responsible for the 20%. And I said, 20% of $100 is $20. Anybody can swing that. Hip replacement that comes to, who knows, $100,000. Not everybody has $20,000 sitting. So Medicare picks up that part. It pays for the 20% that Medicare does not.
Great. Okay. If I like the plan I'm on for A, B, and D, do I notify Medicare if I'm not changing anything?
Nope.
Okay.
Even if for people who we say it's inertia, they just forget to look at their plans. This is the part that becomes concerning for us, is when a person doesn't review their plan this time, and the next thing they are rolled over with the same plan. That's when they realize that the premiums have gone up, and there's nothing you can do then. So we say review and make sure that everything is going to be good for you next year. If you say it's good, don't do anything. If you think, oh, I need to see what other options I have, then you may want to change plans.
Okay, so it's a passive enrollment, basically. You don't have to do anything to let them know if you want to stay on the same plan, but you should definitely do your homework first to make sure.
Yes.
Okay. That's great. So you have answered all of the questions that I had online. I could think the last question, and I've had several people ask, I did put something into the chat, is if you are looking for this information, they want to know if we'll send this out. I did put in there, we will send out a copy of the presentation along with this video so that they can go back to watch it if they would like. So if you registered today or if you've already registered, go ahead. We will be sending this out later on today to everybody who was registered to watch virtually. So I want to thank you, Linda, for being here. I'm going to go ahead and wrap up with our online audience.
Thank you, everybody.
So thank you so much for being here today. We really appreciate it.
Thank you.
Thanks again for joining us. And we will be back next week. We are working on our next presentation is all about diabetic wound care essentials, what you should know. That is going to be on Tuesday, November 11th at 11 a.m. If you are interested in that class, please give us a call. We'd be happy to get you registered, or if you want to watch it online, you're more than welcome to do that. We do also have room in person. The phone number to call us to register is 520-324-1960. Thanks so much for joining us today.